Several healthcare initiatives are being rolled out by the state and federal governments to provide quality healthcare services to Nigerians. Some of these initiatives rolled out by the government is a national health insurance scheme at the federal level, while the state government is subsidizing health services for residents with the state health insurance scheme. Both levels of government are also working closely with a leading health and development consulting firm to help improve health systems in Nigeria. In 2018, HSCL launched a program called Strategic Purchasing for Family Planning, Maternal, Newborn and Child Health Project. 5 years down the line, HSCL is in Lagos State to disseminate end-of-project insights and achievements for Lagos, Yobe and Bauchi.
This project was designed and implemented over the past 5 years, 8 months, support to build the capacities of the state institutions responsible for designing and implementing health insurance at the state level, particularly in Lagos State, and also support the other institutions that had a role to play in ensuring that Lagosians, Bauchi and Yobe residents understand, enroll in the health insurance programs and actually receive the care.
The Bill and Melinda Gates Foundation is also part of the SP4FP MNCH project and our state governments to leverage on the advantages of the program.
We hereby hope the government will uphold its commitment to enhancing the healthcare sector, leveraging initiatives such as the Nigeria Health Sector Renewal Initiative and the Health Sector-Wide Approach SWAP, which will steer us towards a healthier and more prosperous country.
Lagos State Health Management Agency, the Yobe and Bauchi state governments commend its partners for supporting the growth of the state's health sector.
It's been a very activity-laden 5 years with significant milestones and wins. They supported the integration of the full complement of family planning, HIV and TB services into Ilera Eco Plan, using actuarially determined data.
The HSCL has supported the BASHMA through the different agencies to do the health needs assessment, health facilities assessment.
The HSCL supported us in various means in establishing the agency. I could say that they're actually very key in establishment of the agency.
The Director General of NHIA, Dr. Kelechi Ohiri, highlights the role of government in providing healthcare services for the vulnerable population, which is in line with the universal healthcare coverage.
We have an objective and a mandate that I must say borders on obsession to expand coverage and bring more Nigerians under financial protection. And that's why our second objective is an equity objective that leverages both the Basic Healthcare Provision Fund, that is a federal intervention in collaboration with the states to ensure that the poor and most vulnerable are covered.
The Lagos State Commissioner for Health, Professor Akin Abayomi, touches on the issue of family planning and also emphasized the need to urgently address the ongoing relocation syndrome in order not to run into personnel problems.
Now, there's no doubt that Nigeria and Lagos are producing a very high quality of youth bulge. And in fact, when you talk about the JACPA syndrome or the brain drain, what does that equate to? It actually means that we are exporting human capital. We're exporting intellect. We're exporting brains. And all over the world, they're after our Nigerian intellect of our youth bulge. And so it's critically important that we're able to retain those brains within our environment, those that wish to go out, that we make sure that we can encourage them to come back.
Health professionals in this room speak in one voice, saying that advancing access to family planning and maternal newborn health services must be prioritized across states to reduce the burden on parents, as well as achieve one universal health coverage in the country.